David Overholt is a military veteran, a farmer for 20 years, growing corn and soybeans on his land in rural Montcalm County. He also grows medical marijuana. Overholt suffers from chronic back pain, so he's both a caregiver and a patient. After several surgeries, he became addicted to pain pills and ultimately kicked the habit when he started using medical marijuana. It's not just those suffering chronic pain. Minors, even children, are seeing the benefits.
We have a handful, I'd say about 10 minor patients. 4 of them are under 5 years old. These are kids who have suffered from either epilepsy or a condition in which the drugs they're taking is so harmful that it's causing more harm to the child than the condition itself.
He's been the primary face of the dispensary movement in Michigan. In March of 2013, Overholt's Mid-Michigan Compassion Club in Grand Rapids was raided by police and later shut down. He is still fighting the issue in court.
So now I've had to take and appeal that to the Supreme Court and ask the Supreme Court to kick it back to the appeals court and make them hear it. Or actually, which I would prefer, is just send it back to Grand Rapids.
Overholt invited Fox 17 to see his indoor and outdoor grow operations in Sidney Township, where he can grow up to 72 plants, 12 for each of his 5 patients and 12 for himself.
So at any time you're licensed for 72 plants, you can have them on possession at any time, as long as you're with cards and legal patients by the state of Michigan. Any numbers above, you break the law.
As law stands today, Overholt can only provide pot pills and smokable marijuana to his patients. And that's why he says it's so important to legalize edibles.
For one thing, it'll put prospective oils and baked goods into play. You will now be allowed to have and possess brownies and candy and the basic oil itself. But it will give municipalities and townships and cities the privilege of either allowing or not allowing a dispensary.
But it's a massive and expensive undertaking. Just to get a grow room up and running costs about $15,000 for the lighting, watering, and ventilation systems. But that's not all.
Basically, the people I'm dealing with are all sick people. So if the insurance companies aren't allowing payment, in a normal manner like they do to pharmacies, this burden falls on the patient. So I have to get as efficient as I can so I can bring down my cost in order to make this work for everybody.
Electric bills for $2,000 or more, $900 for 3 months worth of fertilizers and organic growing aids, $2,000 for new soil each year, and another $3,000 per month in labor. Here's what state lawmakers are now considering. One bill would allow medical marijuana dispensaries to set up shop in municipalities that allow them, but it does put restrictions in place. A second measure would allow medical pot patients to use edibles, meaning they would not have to smoke marijuana to feel its effects. It also requires pot products be specifically labeled. These measures have already passed the state House and are now heading to the state Senate's floor. Back in Montcalm County, that has caregivers and pot activists like Overholt and others lobbying lawmakers about pot's potential benefits.
We had one woman crying, saying that she wishes her daughter would die just so she doesn't have to suffer anymore. In every single case of these kids, they have gone through the system, seen their doctors. They come in with a book of medical records, okay, literally. And this is their last option.
Now, it's unclear exactly what shape these 2 bills will take, as they are expected to hit the floor come September when lawmakers return to session. But you can expect Fox 17 to follow that progress along the way. Reporting in Sidney Township, Paul Cicchini, Fox 17 News.